welcome back to the Queen City Community Podcast. I don't know if we're still called that, but we're
a work in progress.
We're a work in progress.
Yeah.
But here we go. We are here with Vicki Talbot. Thank you for coming in with us.
Thank you. You're welcome.
You're welcome. All right. And what is your background here at Queens?
So I've been at Queens. This is my 9th year at Queens, and I'm with the Presbyterian School of Nursing. I'm a nursing faculty member. So my husband and I moved here 9 years ago. And before that, we raised our family in Myrtle Beach, and I taught actually at Horry Georgetown Tech and at Coastal Carolina University there.
No way, I just moved to Myrtle Beach past summer, so my family lives there now. That's awesome.
Well, great. It's a great city,
Yeah,
town, I guess. You might not call it a city, so
Maybe not anymore, but
it's a
I
great
love it.
place to live.
Yeah, I love the university too, Coastal Carolina. I was gonna play soccer there actually, but I'm glad I came here. This is a great school. This is awesome.
That's right.
And how'd you get involved with the Bridge Builders Initiative?
So I heard about the Bridge Builders Initiative from Dr. Suzanne Henderson, who is the dean of the Belk Chapel here at Queens, and she really asked me if I would like to be a part of it.
How do you like it so far? Have you seen any real change happening in our communities from that?
Yeah, as I think about the change, I think about the fact that real information's getting out, information that's accurate. I think about the fact that we are seeing an increase in vaccinations. And I really think for every person who's vaccinated, then they have a group that they influence, and maybe they'll influence others to get vaccinated. So I don't really know that we're seeing all the change, but I know that change is occurring.
That is very true. I think getting students involved in all of that, they can access so many different communities that all in all, it makes not all of change, not 100%, but it makes some change. And I think that's what we need. I like it a lot. I think we got to keep going.
Okay.
I think we have a lot of work to do.
We do. COVID is still here.
How do you think it's going to change with the boosters coming? Do we think we have to start over, or do you think most people are already going to get it since they got the vaccine originally?
I think, I got my booster a couple of weeks ago. I was really glad to do that. Just with the holidays coming up, I can't stress how important I think boosters are. And I think we just have to keep on going because people do get complacent. They'll think, well, I haven't gotten the Delta variant or something like that yet. So they may think they're going to be fine.
Yeah, I think it's kind of sad that we have to have the boosters because, some people that were hesitant to get the original vaccine, all in all, they're already like, oh, man, they're not effective anymore. How can we trust the boosters? But we have to trust our medical society. That's the thing. And I bet it was such a dramatic sadness for all people involved in the medical society, scientists that created the vaccines, doctors, that most people don't trust them, when it comes to vaccines and COVID-19. And that's just sad to me. What do you think about that?
I think that this vaccine has probably been politicized more than any vaccine that I know of. I know there have been some in the past, and I have had many, many vaccines to travel to other countries, certainly because I've lived my life with vaccines. But I think that because of our healthcare system, many people are complacent about the vaccine because they feel like if they get sick, our medical system will care for them. And I think that's not a very good reason not to get vaccinated.
Yeah, that's right. Yeah, the hospitals were all getting full and stuff.
Yeah, with your perspective being in the nursing school and having expertise in nursing, how do you think that this is affecting the nurses in hospitals outside of from what we know, but from a more deeper perspective?
I think the effect on nurses in general has been devastating. I'm very privileged to work with the next generation of nurses, and that's very important to me. It's also important to me that they stay in nursing for at least a while, and I think we're seeing a great number of nurses leaving nursing the bedside early because they're exhausted, they're overwhelmed, and their job is scary now. So I've had some breakfast, some lunches with some of our nurses who've graduated in the last year, and they have been greatly affected. A lot of them have already left the bedside, even after a year or shorter, because it is so overwhelming to them. They're afraid they're going to make an error, they're overworked, they're being asked to work extra shifts, they're thinking about what they're exposing their families to. With just this influx of patients with COVID, as it continues. And I think one of the most difficult things is they know that if people would get vaccinated, these numbers would really change.
Yeah, that must be frustrating. And, we can work remotely, we can study remotely, and other jobs can probably do it too. But nurses they're the reason we're all, keeping going. They have to be at the hospital. There's no remotely working for nursing, which kind of stinks.
And where are they going once they leave that bedside community? Where are they going?
Oh, they're going all kinds of places. They're going to community health nursing. They're going to, they can actually work remotely, doing physicals, those kind of things. As far as for insurance companies, there's a lot of things they can do, nurses can do now, and have a good salary without really going into the hospital, working long shifts and taking care of patients who are in such need. I think another thing is, before COVID, nurses were very focused on physical care, emotional care, and some spiritual care. But now with families, chaplains, other parts of that interdisciplinary team we actually enjoyed working with to help care for patients, nurses have been the only people sometimes to care for all different things on the patient.
Yeah, most of my friends are nursing students, and they always have because I have some pre-med students that want to be doctors and surgeons, and nursing students, and they always talk about the differences, and they talk about how nursing is actually caring for the person, caring for how they react, how they emotional side and physical side, which is amazing. I love that. And if I would pick one, if I was in the medicine area, I would pick nursing, because that's what I am, truly compassionate and caring for someone. So that's nice. And I feel like they've been affected so much, seeing people die, and it must discourage a lot of people. Have you seen a more of a demand or an increase in nursing students because they want to help since COVID-19 came along, do you see an increase in nursing students trying to be a nurse to help out the community, or do you think it's decreased because of COVID-19?
I think it probably increases and decreases according to what area you're in. We've not seen a great increase in numbers here of people applying. We certainly have people applying, but I think people are going to be hesitant to go into a profession that puts people at the bedside, front line for this.
Oh yeah, they're the first responders, first soldiers, and sacrificing your own life to save someone else's. That's a big decision. It's a very big decision. Do you see COVID-19 being like the flu, like kind of a forever type thing?
It's interesting, and I was doing some reading on that yesterday and today, and there's a lot of speculation out there about the different variants. It is a virus, which means it does change. It can change. And I certainly think something like this will be with us. I think if we get vaccinated, that will improve. It will improve. But as you look at other countries, different variants are coming up. Certainly with the vaccination, people aren't getting as sick. So I don't know that we'll have to get a vaccine every year, but we just really don't know yet.
Mm-hmm. Yeah. And with that, do you believe that the vaccines will have to be constantly updated like the flu vaccine is with the new strains?
I don't really know about that because it's an mRNA vaccine. So I think that the virus would have to mutate greatly to get a total different vaccine. But, the biochemistry of vaccines, that's not my specialty, so I really don't want to speak on that.
No, of course. Yeah. And I was going to ask, what is your specialty? What area have you been in and worked in? I would love to know about your work history.
So I started out as many don't start out, but I did start out in an ICU. That was my very first nursing job. And then I went to Emory and worked at an open heart unit. So I moved from ICU to ICU. Then my husband and I got married. We moved back to South Carolina. I worked in a general ICU and then later a PACU or recovery room. Did some nursing education and supervision at a hospital. Then went and got my master's and really got an interest in oncology and cancer nursing. So I spent some time working with 2 oncologists after that. And then as I started my family, 3 kids in 4 years, I moved into some teaching and have been in teaching where my really focus is acute care, the critically ill patient. So I do teach COVID to my nursing seniors, and we teach ventilators. And if everybody had the chance to see a patient on a ventilator and to realize that COVID patients many of the sickest end up on a ventilator, maybe a dialysis machine, and having to be turned even on their stomachs. That's the word for prone, is what they have to be turned. And so you have to employ other help to turn the person while on the ventilator. If you just saw the experience those sickest patients were enduring, I think people might think again about maybe getting a vaccine.
Yeah, I did a Faith in the Vaccine initiative this summer, and I interviewed Dr. Jaspal Singh. He's a pulmonary critical care specialist at Atrium Health, and he was telling me about his stories and about his patients almost having to go into ventilator and being really sick and being like, I wish I could have had the vaccine now. And that hit me, so I did a whole documentary on how I became safe with knowing I should get the vaccine. So I got the vaccine after I talked to him. So it was really helpful to me listening to that. I was like, okay, yeah, let's go get the vaccine. And my whole family got it, and I'm glad we did, because that must be such a painful experience for everyone involved, especially the nurses. The mental toll to see people dying, I can never imagine that.
When they were first talking about the vaccine, I consider myself a scientist, and I was like, I've taught pharmacology before, and I thought, they might be bypassing some safety protocols. Maybe I'll wait a little while and see about getting a vaccine. Then my parents, who are 89 and 87, got COVID at Christmas. And so I went to their home, and I stayed with them, and I took care of them the whole week. Wore a mask and really cooked for them, did everything. And I got them the antibodies, got them a chest x-ray, I took an O2 sat machine with me. I did things that most normal people wouldn't have access to as far as thinking through to do. I had my stethoscope, listening to their lungs all the time, and they ended up being okay. And I ended up testing negative. So that was all great for all of us.
Wonderful.
But after that experience, I just thought, as soon as this vaccine's available, and I work with college students, I want to get that vaccine. And so I think I also read the book, The Code Breaker. I don't know if any of you've read that.
What is that about?
It's about mRNA vaccines. It's about the CRISPR technology. And I read that book, and I was like, okay, they've been working with these mRNA vaccines a long time, and they really pulled together some of the greatest minds in the world to work on this vaccine. And with technology, which you guys are familiar with, they were able to share their data and share their findings and really come up with this vaccine very quickly.
Yeah, I've heard that sharing all around the world was so open and so free that doctors had not seen that in a long time.
Right.
Between countries, and that was really inspiring because everybody just wanted to get back to normal.
Right.
I think that's a big thing. Do you has the curriculum of nursing then changed a lot since COVID, or have you adapted to it? Since your nursing students are going to have to deal with that day to day.
Well, I think what you experience some change. Certainly here at Queens, we experienced change when all of a sudden we had to go home. And then we even had to do clinicals through an online format right in the beginning. It's been certainly hard for our nurses to adapt to clinical units. During some of the semesters, we would see a lot of students not sent home, but exposures, and so we had to do online teaching with them. So we've had to do a lot of that, which makes it difficult, and certainly our classes had to be online. I can say bringing students back to campus, the nursing students are so much happier being on campus, even with us wearing masks, that they can learn a discipline which involves practice versus trying to learn that online. And the vaccines have changed our clinicals in that students are able to stay at clinical. And even when they're exposed to a patient who maybe wasn't vaccinated and they test positive for COVID, it's really not an exposure because the student has the proper PPE, mask, N95s on, those kind of things many times. So it's really helped them to stay in school and to stay in the hospital better. The vaccines themselves have done that.
So with my understanding of nursing, you do the 4 years of college, and then from there on you're cleared. You take a test and you're cleared to work in a hospital.
So after nursing's kind of mixed up. You can get a nursing degree in 2 years of a different kind, an associate's degree, but a baccalaureate degree, like we offer here at Queens, the first 2 years are your general science and your liberal arts, really well versed in that, and then the last 2 years you focus on your nursing classes. And after you graduate successfully, you are able to sit for the national certification exam. The NCLEX is what it's called. And then after that, you can work, seek a job in any really field of nursing.
Is that the path you took?
So yes, I actually, shout out, went to Clemson University.
Ooh, I love Clemson. Most of my friends go
Aunt went
there.
to Clemson.
Okay, yeah. So I went there and got a 4-year degree for nursing. So I did start out with a baccalaureate degree, and after that, got a job in a hospital and an ICU.
Yeah, I see. Did you feel prepared? Because I bet it's so scary going from, clinic, practicing here at college, and then doing your test exam, and then going into hospital and working. Did you feel prepared at all, or?
I did not feel prepared. Okay, I did not feel prepared. There were a lot of changes happening then in nursing, and I think that's what's made me so passionate about helping our students feel prepared.
Oh yeah, I bet.
I know that this has been kind of a joke around the internet, at least that I've seen, where it's like, oh, I don't know how to do an IV, I learned online. But do you think that there is a general fear in nursing students that they might not be prepared for anything that they're going to be up against once they enter the field?
Well, you'll never be prepared for everything, that's for sure. But I think if we can help students learn to critically think, I could take both of you downstairs as long as you're not squeamish about certain things, and I could teach you on a simulator how to start an IV. And so that's a technical skill, but what I really want students to know is who needs an IV and who doesn't, or when an IV might be in trouble or infiltrated, and how to check that IV, and all those other things. So certainly their skills will be limited for those who've not had as much clinical practice, but we're very thankful here to have a wonderful simulation center. And so, hopefully they're being as prepared as we can help them.
Oh yeah, all my nursing friends say, they're like, "Oh my God, it's so much work. Oh my God, I can't do this." And I'm like, "Good, because if you're gonna be taking care of my family, I appreciate you being prepared."
When I come to my friends who are in the nursing program, I want to know that they can take care of me, and I feel like they are getting that preparation
Exactly.
at our school, and I think that's a great thing.
Exactly. How do you feel about the vaccine requirement here at Queens? Do you think it was the right choice?
Oh, definitely think it was the right choice. I think it has changed the education experience this semester for students, for faculty, and I think it is just really good that people are seeing one another
Oh
again,
my
because
God,
the isolation was just very, very difficult for many people.
yeah. Do you think yeah, mental health was a big issue, and are nursing students being taught to deal with their own mental health when taking care of patients, as well as trying to get the patient to talk about their mental health? Or is that a big part in nursing, or?
It's really interesting, and I'm a person who's really about health promotion. And so I really try to encourage my students. Like yesterday was beautiful, today's beautiful, and I encourage them to get outside. I'll send out an announcement on Canvas and say, hey, your PowerPoint's posted for Thursday, but get outside today. It's beautiful. And then just really challenging them to find things now that are helpful for their mental health. Whether it's exercise, do something constructive that really puts life into you, because that's going to be something we all need forever,
Oh
right?
yeah, yeah. I'm a big advocate for that, and just feeling happy with yourself. It's so hard to do these days with social media, and I can't even imagine going to a job where you see sick people all the time. That must be tough. So that must, wow, yeah.
Yeah, I'm a huge advocate for mental health, and I was walking outside today and I was like, I should do homework outside because this would be really nice. And I think that's really important, teaching those skills now so that they have them when they get into the field. I know I've seen on social media so many times perspectives of nurses, even veterinary students, excuse me, that have just struggled so much with the weight of it all. And I think that's so important. So thank you for helping your students prioritize that.
That's awesome. Yeah, and I meant to ask you, what is your current role in Bridge Builders and the Bridge Builders
So
Initiative?
this past summer, I had 13 ambassadors that I worked with on different projects, and a little different from some of the other ambassadors. All of mine had graduated in May. They were all nursing students, so they were studying for their NCLEX, getting ready to be registered nurses. And so I've just really coached them up and spent time with them and attended their projects and worked with some clinics, those kind of things, and just answered as many questions, kind of like what I'm doing today, except not in a podcast. And I love to learn and I love to study, and so I've just tried to study up a lot and keep up with the changes. The changes are occurring. I don't know if you guys have seen this week. So the vaccine for children is fully approved now by the CDC. And they're also, really working on a pill. I don't know how that's going to work out, but there's a lot of research being done to try to see how long immunity lasts after boosters, and not to mention all the data that's being gathered.
Oh yeah, yeah. A lot of work still has to be done, which is cool. And I'm glad people, such as people with a background in medicine like you and nursing, all that stuff, are getting involved in it. Because I imagine if I was listening from someone like me who has no background in nursing or medicine whatsoever, and if I was listening to someone like you, I would trust you more. And the fact that you're out there helping the community is awesome. So thank you for that. And yeah, it's amazing.
Yeah, we admire your work and we're so happy that you were able to come and join us today.
Yeah, and you guys asked me, you said one question you might ask is what I would say if I could say one thing to people, right?
Exactly.
And so that kind of walked around with that thought in my mind for a couple of days. It kind of changed a little bit, but I really thought, what is my unique perspective? I'm a nurse, I'm a faculty member, I'm a mom, I'm a grandmother of 3 beautiful granddaughters and a baby boy on the way. So, yeah,
Congratulations.
so, and my parents are older too. So I thought, what is different? And I thought, one thing I would say is get good information. I think part of the problem with this is people tend to just Google or use Facebook for their information, and there's so much out there that's wrong. There's no tracker in the vaccine. I personally carry several trackers, my iWatch and, my iPhone. I mean, those are my trackers, and then my Netflix account, all
The
those.
government knows where you are.
Right.
Yeah, they don't need to put something in you.
Yes, it's not a tracker, it doesn't change your DNA. And I think that's young people like yourselves, many times that's one of their concerns. The injection itself is pretty painless. It's not a big needle. It's a very small needle, and a lot of people are afraid of needles, but that's okay. You know, there's a lot of other inaccurate information out there that we could talk about all day, but I would just say find good information for number one. And then think about how to stay healthy. As I said, it's health promotion. And I think if we would shift our focus in our country from illness to health promotion, we could redo our healthcare system. We could change it, which certainly needs to happen. And then just the fact that think about your nurses and your medical, the people in the medical field, they are exhausted. You know, just get a vaccine. Think about that. Because
It's not about you. It's not about you anymore. It's about
not
all
about
of us.
us. It is about all of us. And I do know that some of the countries I've visited, they would be lining up for the vaccines if they just had the opportunity for that. So I would just encourage everyone to think about that and really weigh the odds. My husband and I were talking, you know, I don't know anybody who's died from the vaccine, but I know a lot of people who've lost family members, and we know some people who've died from COVID. So
Yeah, it's really tough. We lost my aunt, my mom's very close sister, and it was devastating. And as soon as that happened, you know, it just pains me to see that people don't. It's not about you again. It's about all of us, and to protect each other, we need to get the vaccine. And other countries, undeveloped countries, like for example Brazil, they're just getting more and more vaccines now. My dad got his one last week. I've had mine for months now. So that's just crazy. We're privileged to be here in this country, and we got to look at it like that, and we got to protect each other.
that's right.
Yeah, well, thank you so much for coming in, and it has been amazing.
Well, thank you guys.
Appreciate you
Thank y'all.
so
Thank
much. You have such